Hello everybody, we are CarbaTeam and this is our innovation idea, the implementation of Blue Carba-Test. Bacteria are one of the main disease-causing microorganisms in humans. The way they were trained began with the discovery of penicillin in 1928. Since the number of broad-spectrum and specific drugs has been developed to combat antimicrobial resistance bacteria that has been generated over the years due to their indiscriminate use. However, bacteria, while like any organism on Earth, adapt and evolve to survive, so when exposed to harmful substance, they develop antibiotic resistant mechanisms, such as a carbapenems. As a curious fact, carbapenems were developed in 1976 and the first carbapenems bacteria was reported in 1982. The time elapsed was only 6 years, demonstrating how fast bacteria are to adapt. In Guatemala, the lack of resources and infrastructure in rural health centers to perform the corresponding antibiogram test in case of bacterial infection results in a non-specific diagnosis, leading to the prescription and administration of broad-spectrum antibiotics on patients, which contributes greatly to the increase in antimicrobial resistance. Over the years, there are fewer functional antibiotics and there are more multi-resistant bacteria that cause infection not only in the hospital, but also in the community. That's why in 2015, this problem was declared a global crisis by institutions such as the Infectious Disease Society of America, the Center for Disease Control and the Prevention, and the World Health Organization. The GLASS Global Antimicrobial Resistance Monitoring System seeks to ensure that all countries around the world take a standardized approach to collecting, analyzing, and sharing data on antimicrobial resistance globally to lay a scientific foundation for preventive action to increase antimicrobial resistance. However, in Guatemala, there are no public data and information on the subject and public information available is on date. So we consider that Guatemala's epidemiological data do not reflect the reality of antimicrobial resistance, as most laboratories inside of the country don't have the resources to perform antibiograms, causing the lack of reports on such resistance mechanisms to the Laboratorio Nacional de Salud, preventing the generation of statistical data necessary for the taking of decision by Ministerio de Salud Pública y Asistencia Social, as well as a lack of a contribution to the GLASS project.
The first case at risk of death in the intensive care area of the Hospital San Juan de Dios was caused by Klebsiella pneumoniae carrying the carbapenems gene, BLA-NDM, and BLA-KPC, and come about in 2012. But until 2016, it was reported by Tamara Velázquez, made it known in her research, detección de genes de carbapenemasas, BLA-KPC y BLA-NDM en aislamientos de Klebsiella pneumoniae del Hospital San Juan de Dios de la Ciudad de Guatemala. It should also be noted that Ortega in 2014 emphasized that 23% of Klebsiella pneumoniae isolation of samples from the Hospital General San Juan de Dios had a presence of carbapenems, where 93% of these were type MBL and 7% type KPC. It is therefore that Pintos et al. In 2020 Corporation of tests in laboratories that would allow quickly and accurately the diagnosis and monitoring of infectious disease caused by multi-resistant bacteria, such as meningitis, pneumonia, bacteremia, urinary tract infection, intra-abdominal infection, and intravascular catheter association. The technology currently used in the National Hospital, Hospital San Juan de Dios, and Hospital Roosevelt is based on the PCR, which although is exact and precise, it requires infrastructure and reagents, making it an expensive test and limiting its accessibility. For what the laboratories in the rural area do not have implemented such technology, This limits the epidemiological research of AMR and the appropriate diagnosis of the disease. Therefore, we're looking for implement an easy and accessible test that does not require a complex infrastructure. Blue Carba-Test in order to achieve a timely diagnosis that allows the doctor to prescribe the specific antibiotic, that promotes the recovery of the patient and avoids the increase of resistance mechanisms by use of broad-spectrum antibiotics. With the implementation of the test, we also pursue to motivate laboratories to report the findings of bacteria with carbapenemesis to the Laboratorio Nacional de Salud. In this way, we can contribute to the epidemiological research of AMR in Guatemala.
The blue Carba test is mainly useful in detecting carbapenems in Enterobacteria of the genus Pseudomonas and Acinetobacter. It uses as an indicator the bromofold blue that in conjunction with SO4 detect the presence of carbapenems enzymes generate a blue to yellow color reversal indicator a positive result. Pires Erlot in 2013 demonstrated that the test has a specificity and sensitivity of 100% detecting carbapenemasses producing KPC, EMP, MDM, BIM, SPM, and OXI. Munoz and Erlot in 2017 comparing the blue Carba test with the conventional PCR reference method obtained a sensitive and specific result of every 4.6% and every 7.5% respectively. Being a colorimetric test is easy to interpret and its chemical contents are accessible from obtained on the market, which make in a simple and economical test. Advising on this sensitive and specific make is also a reliable and effective test. Therefore, by implementing blue Carba tests in public health centers in rural and urban areas that don't have the analog technology to perform the tests in a hope to be able to generate in the first instance the identification and diagnosis of bacterial infection by carbapenemasses in patients and also obtain and generate epidemiological data on this type and antimicrobial resist.
If CarbaBlue test is going for communities with more limited access to health will be able to expect targeted diagnosis system. This will allow generate AMR data from inside the country and for health system to take into account the needs of the rural area. With this, it's expected population will be able to obtain adequate medicines and do not promote AMR in order to solve their health problem. At a general level of the country, the data generated will be more significant because with this information, more people could analyze and take action to reduce AMR in Guatemala. The risks to do not carry it on fall in the increasing the rate of infected cases by multi-resistant bacteria in a hospital. The community is also affected by the same patient without adequate treatment. This represents an economic burden for the country due to the need for stronger antibiotics and consequently an overload on the health system. If these events are not controlled, mortality from multi-resistant infection will increase.
In your country, we hope to have the help of the Laboratorio Nacional de Salud, who could provide the reagents, inputs, and trained personnel to help use and instruction in the implementation of the test in addition to the support of Fundewa in the rural areas of the country for the management and implementing of the Blue Carba-Test in multilingual communities. Thanks for your attention, and we invite you to watch your video on YouTube about the Blue Carba-Test.